Good evening. Thank you all for being here on this beautiful night. I'd just like to make an announcement that we are recording this because the SAFE agency has a wonderful website, safeglencove.org. So we'll put it up there on YouTube. For anyone who couldn't be here this evening, they can go look at it. And if you want to look at it again, you're more than welcome. If you have anything personal to talk about that you don't want recorded, you can speak to our, you can talk to our speaker at the end. He'll be glad to wait and let you talk, all right? Mr. Mayor, thank you for being here. Deputy Mayor, thank you for being here. Council people, thank you for being here. And former Mayor, thank you for being here. I just want to take a minute and recognize SAFE Coalition. We have brochures up there, you can read all about us, but this coalition is very, very special. It's been around, I think we're in our 16th year. It took time to build it, but every corner of this community is represented on the coalition because our goal is to eliminate drugs and alcohol abuse in the Glen Cove community. We are getting there, little by little. We're not a treatment center, we can refer you, but we are an educational and an intervention agency. We have, I'd like all the members of the coalition to just stand for a second so people know what I'm saying, and you probably recognize most of them, because, thank you. You too. You probably recognize most of them because they do other things in town, like plant bowls or whatever's going on for the day, the Kiwanis. So thank you, Coalition. And even though when you go on the website, you'll see all the many things that SAFE does, we only have 4 staff. We have a full-time director, please stand, Sharon, and we have 3 part-time workers, and there's Nicole. So I'm very proud of the coalition. I'm very proud of the staff. And my name is Georgie Kinnett. I'm the board chair. I forgot to mention that part. We're going to have an amazing presentation in a few minutes. But before we get to that, I would like, with this sign, to ask to come to the podium the school committee and our young person and parent. Please, they have something to tell you.
Thank you, Georgie. Thank you, Dr. Harris, and everybody else that's here this evening, Stephen as well. Looking forward to your presentation. So, my name is Anthony Gallo. I'm a health ed teacher, but I'm also the co-chair of this fantastic organization, the Substance Abuse Free Environment, trying to make our community as healthy as possible. And what we did with the school committee was that we brainstormed a bit, and we want to bring more attention to this epidemic that's actually happening as we speak right now in our entire country, and it's this opioid epidemic. So myself and the school committee, which includes Director Peter Cardone, who has another engagement tonight, so he's unable to make it here tonight. We worked together with Dr. Harris and with the rest of the committee. Patty was at the meetings as well as Nicole, and we got together and we came up with this contest, which took place in our health education classes, in my class and Mr. Jake Freitag's class as well. He's also one of the health teachers in the school district at the Glen Cove High School, and he also works at the Robert M. Finley Middle School. So we came together and we tried to figure out, let's set up an art contest. Now, when you calculate all of the classes that we actually have, we have 8 classes, health education classes in the second semester, and there was about 250 students that participated in this in-class project. And we basically said to them, we shared some facts about this epidemic of opioid abuse and then a lot of the overdose deaths that occur with it. And we said, here's what we need. We need try to come up with a a slogan, a logo, it's an art contest, be as creative as you possibly can. This was done in class. And what I'm very, very proud of, a couple of the students where we culled all of these art projects together, we reviewed them, they were passed on, a handful of them, about 10 were passed on to the SAFE Coalition Committee, and 2 were selected as being the top 2 projects that were selected. One, the second place winner is Janelli Arroyo. I don't see her in the audience here, but she had a fantastic design that was selected. And the first place winner was Isabella Juarez, who is currently sitting right here in the 3rd row. So let's give Isabella a hand. So congratulations to Isabella Juarez. And what a fantastic idea. Her artwork, this is the genesis of her artwork, which was on paper. And then her artwork was sent to the graphic design department at the Glen Cove High School, and they tweaked it. And this is what was the final rendition of this opioids project here. So once again, what a consistent and clear message here as we try to cancel out and prevent this epidemic from becoming worse and worse. So this is going to be on Facebook, I hear. It's going to be promoted a lot, and I'm very, very proud of your efforts. And it's going to be all over town as well. So let's give Isabella a hand again. Dr. Harris, if you want to share anything, feel free. And what we have here from the coalition is a little gift for you for being the winner. So thank you again. Sure, I could do that.
Thank you so much. At this time, we're going to hear from Mr. Steve Chassman, Executive Director of LICADD. We're going to hear a lot about what's happening with the opioid epidemic. Oh, excuse me, I'm sorry. You're up, Mayor. Oh, I'm so sorry.
Thank you. Thank you, Dr. Harris. As we all know, I mean, you can't go a day recently without seeing something on TV or in the newspapers about the opioid epidemic and how it affects so many communities, not just on Long Island, not just in New York State, but throughout the entire country. So it's a huge problem, and the fact is that we need to have attention brought to this subject. And the way you do that is you have education. And this art thing we had, can I see the sign again? This is one way to get our young people involved to understand what this is about so that they can express what their feelings are, and also to allow other kids their age to know what's going on. And this is not something that just affects either young people or old people or homeless people. This is across the board. I mean, we're talking about people that have high-paying jobs that are in the industries and stuff. This affects a lot of people. So it is a major problem, and it needs to be addressed. And I think that the way we need to do that is to bring it to the forefront and bring it, from the time that these people are in school, the young kids, educate them there, and to have people like Mr. Chassman who come in and educate us. Recently, we had a course that was given, I believe, at the CTI Temple for the use of Narcan, which you would think is, oh my gosh, but that saves lives as well. You need to have people aware, know what the signs are, to have the ability to save someone's life. And the only way you can do that, again, is to bring this and to talk about it and to discuss these issues. And I think that doing these things, and I really do appreciate you being here, and I want to say thank you to the SAFE Foundation for their work in this field. I mean, you guys, again, with a staff of 4 people, do so much to help our community out. And I want to say thank you to Georgia, to Dr. Come on, I know, Sharon, Dr. Harris, and everybody else who's on there, on this, it's actually, what is it, an agency? How would you, it's the foundation, right? A coalition. But on behalf of the city, Isabella, I want to bring you back up here because I have a citation for you, certificate of special recognition for the work that you did, the time that you took out to express and show us your abilities in the art area. But this one is for you. It's dated today, saying thank you and recognizing you for making this sign for people. And if it saves one life of people to be aware of what's going on, it's all worth it. So this is for you. Why don't you take that? Let's take a picture right here. Would you like to, Mom, would you like to come up too? Come on. Let's bring can we bring the coalition up, the SAFE Coalition, just for a quick picture? And if we have our 2 council people that are here, Pam Panzerback and Marcia Silverman as well, please come up for a photograph. Yeah, we'll hold the sign. Yeah, the whole, that's what I said, the whole coalition. Thanks, Tony. Okay. Can we squeeze in, everybody? Squeeze in. Maybe some people in the front, you know?
Keep it on you. Short. Nicole. Come on in.
Okay, thank you. And it's our hope that with the progression of these types of things, that we can start to chip away at this problem, and because it affects, I think there was something like 200,000 people who have died since this epidemic had begun. And you know, I believe in Glen Cove, because of our education process with the children, our numbers are lower than the average throughout the rest of the country. We still have these issues, but we're at a much lower rate, and I thank our police department, people like you, Mr. Chassman, our SAFE Coalition, for doing what they can to make sure that this issue is recognized and dealt with. So thank you all for everything that you do. I really appreciate it. So we'll bring up Mr. Chassman now, and he'll, yes. Thank you very, very much. Appreciate it.
Thank you to the mayor. I'm going to use this because I think they're recording the presentation. Good evening, everybody, and thank you, Dr. Harris, for the invitation. It's my second time in 2 years being invited to the city of Glen Cove, and really this is how you stop epidemics. Respectfully, you have clergy, you have elected officials, you have educators, you have coalition leaders, you have parents, you have young people, and everyone comes together and they exchange information. Last year we spoke about the opioid crisis, and lo and behold, it hasn't gone away in a year. But what has happened in the last year, now, before I get into it, let me preface this by saying, I work for a not-for-profit that's 63 years old. We have 4 offices in 2 counties. We're neighbors in Westbury. I am a licensed clinical social worker and a credentialed alcohol and substance abuse counselor. What does that mean? I am not here to comment on government policy. I'm not interested so much in policy. I'm not here to cast moral judgment on what is ethically right or wrong. I don't get to make those calls, all right? Respectfully to our law enforcement and the men and women, the city of Glen Cove, Nassau County, Suffolk County, across the country have been very influential in getting drugs off the street and maintaining order. We thank our law enforcement, but you know, working at LICADD, we're really not interested in what's legal or illegal either. I saw 2 young people this afternoon all using illicit drugs, 1 cocaine, 1 heroin. Could you imagine if he said, I'm using 5 bags of heroin, and I said, heroin, that's illegal? He probably would have had some choice words for me and left. I'm a healthcare professional. So the purpose of tonight is only to speak to what's healthy or unhealthy, all right? And the truth is, more Nassau County residents, adolescents and adults, more Suffolk County residents, New Yorkers and Americans are making unhealthy choices around substance use at a rate we've never before tracked. So the mayor's statistics were in and around the ballpark. 2018, and we're in 2019, was a tragic record. Nationally across the country, there was 73,000 opioid-related fatalities. 73,000. Now, here's something you don't talk about. Let's talk about legal or illegal. Memorial Day is coming this weekend. Prom season is coming. We're a summer island. Glen Cove is a summer city, right? Last year, 3,000 opioid-related fatalities. There were 88,000 alcohol-related fatalities. Any baseball fans here? How many people does the new Yankee Stadium hold? 46,000, thank you. So find me a disease that kills 150,000 Americans every year, alcohol and or opioid or other substance use, and quite frankly, it's a shame we've done so little thus far, okay? Now, we have not yet emerged from this substance use crisis, which, by the way, whether you know it or not, you're kind of standing in the epicenter of the crisis. I'm not going to put our civic leaders on the spot, but I'll let you know a secret. There's 62 counties in New York State. I don't know if our elected officials knew that. There's 62 counties. The highest incidence of overdose in the entire state, Suffolk County. The Bronx, number 2. Staten Island, number 3. Nassau, number 4. Now, as the mayor said, this is not an indictment of I'm an islander. I was raised in Nassau. I live in Northport, Suffolk. I'm a product of Belmore Merrick Public Schools. Great place to raise your kids, great place to grow up. So is Suffolk, all right? But let me tell you that we have been hit disproportionately hard, and that's something we have not yet inquired about. It's not what drugs people use, it's why they use them. Why they use them. But in the last year, as many other states, and you know, I was away at an emerging leaders conference all last week. I was in Portland, Oregon, but I'll tell you what Portland is about. And if you've been to any of the states that have moved to the legalization model, and please, we are a great supporter of Governor Cuomo. He has been very progressive in freeing up funds. I'm not a politician. LICADD's apolitical. He has been very responsive as the New York State Assembly and people from both aisles in freeing up monies to fight this epidemic. But this is not an opioid epidemic. People don't wake up one day and say, oh, today's the day I do heroin. It just doesn't happen that way. Now, Belmore Merrick, I won't tell you, I'm class of 1990, whatever, but someone like me with shorter hair probably came in 4th, 7th, 11th, and maybe 12th grade. They said there are 3 gateway drugs. Those 3 gateway drugs are not innocuous as defined by Webster. They have the potential to cause a host of biopsychosocial dysfunction. Those 3 gateway drugs are the same but different, all right? Alcohol has always been, continues to be in 2018, the most lethal drug in America. 88,000 alcohol-related fatalities in 1 year, all right? 88,000. And by the way, heroin withdrawal, you wish you were dead, it won't kill you. Alcohol withdrawal will, if you've ever seen anyone with the delirium tremens or in detox. Drug number 2, nicotine. You know, we did really well, and I'm not going to judge anyone's age, but forgive me, Mayor, but when you went to high school, you could probably smoke in high school if you were 18, right? Okay. I just missed it because the nicotine age limit went up in the mid-'80s to 21. We did really well with adolescent smoking. Now, my parents are in their 80s. They'll tell you in the 1940s and 50s, we didn't know smoking was bad for you. You didn't know putting smoke in your lungs was bad for you. I mean, come on. But the Surgeon General came out, we did really well with adolescent smoking for like 25 years. And you know what happened 8 years ago? The vaporization of nicotine. Do you know nicotine is a drug? Does anyone know what kind of drug it is? What is nicotine? It is, in fact, a stimulant. I don't see any other stimulants here, but caffeine, nicotine, by the way, amphetamine, cocaine, this is a mind and mood altering drug. By the way, I was here a little early. Dr. Harris knows I'm chronically early, which is a good thing. But I live in Northport, in and around Huntington. If anyone knows Huntington, and maybe Glen Cove is similar because I was just there, do you know where people hang out on a warm summer night? In and around the Starbucks, if not the beach. And they're doing double quad shots of espresso and tearing up the street. I just saw a bunch of kids in there. I don't know what they were drinking, but it's caffeine. It's a mind and mood altering substance, as is nicotine. And the last drug is what we're here to talk about, is marijuana. All right? It's not just flower marijuana. Now, I'm not suggesting anyone here, I'm not going to put the mayor on the spot, and ask, how many people smoke? No, we're not going to do that. But if you smoke marijuana in the 60s, 70s, 80s, or 90s, this ain't it. And if you think it's a bunch of old men from Colorado wearing tie-dye t-shirts with long gray hair tied back, you're wrong. The legalization movement in America is men and women in $10,000 suits with a multi-billion-dollar business model geared towards our kids. Now, I'm only here to give you the facts. First of all, marijuana is not even grown in the earth anymore. It is because of hydroponics and genetics. Mother Nature's marijuana, the THC, the active ingredient that gets you high, used to be down here, and I have some slides on that. The THC in marijuana, if they're even using flower, today it's the vaporization of highly concentrated THC oil, right? THC products. What are products? So I was just in Portland, Oregon. I've been to California, okay? These are states that have legalized. Anyone been to a legalization state? No? Have you been to, I can ask this. I went into 2 dispensaries in the week I was there, just to see dispensaries where they sell legal marijuana, okay? Let me preface this by saying I'm a healthcare professional. We do a lot of work in the Nassau and Suffolk County Jail. I don't think people that use marijuana products belong in jail. That's not this discussion. But to say that marijuana is harmless is simply not true. Because of the 1,132 people that came through 4 offices in 2 counties last month, April 2019, or the 15,000 people that came through LICADD doors last year, all of them with serious and profound issues with mind and mood altering substances, not some, not most, but every single one of them had a history of marijuana and alcohol. Every single one of them. Now that's just the facts. I don't need the Centers for Disease Control, the National Institute of Drug Abuse, which, by the way, has been very vocal about the potential dangers of marijuana when people start experimenting with it at a very young age. So I went into these 2 dispensaries in Portland, Oregon. First of all, you walk in there, there's neon lights, there's disco balls, right? And there's a whole wall of different types of marijuana and different types of oils, which are highly concentrated THC oil. On the other side is the edible section. What are edibles? Go ahead. Yeah, I specialize in unsolicited attacks. What are edibles? Correct. Food products that have been infused with THC. So you had your gummy bears, you had your Swedish fish, there was some clever name for them. You had Pop Rocks that were THC infused. Now, I don't know, but with the glitter and the packaging, this was not geared to a 49-year-old man who wants to sit back and smoke a little weed on the weekend and watch Seinfeld episodes with a box of Entenmann's. This was clearly geared, respectfully, to young adults. Now, people have been asking me all the time, whether it's the news or elected officials. We got calls from Congressman Swazi's office and Congresswoman Rice's, what's the deal with marijuana? Well, the reason that the federal government is calling Long Island, and these are respected elected officials, particularly Mr. Swazi, who's been a longtime supporter of LICADD, because it's federally illegal, we don't have accurate data. It's been federally illegal. They have not given Johns Hopkins, Harvard University, or Columbia University $200 million to study the impact of chronic marijuana use on adolescents or adults over time. The data is skewed. All right? We'll go to the next slide. Thank you to my helpers. Can I get a round of applause for the helpers here? Without boring you too much, this is how I've been in drug treatment for 25 years. All right? Remember, we're standing in the epicenter of the crisis in New York State. Oh, I don't know what that is. Autofocus. Okay. Let's see if that goes away on its own. It working? Oh, it worked. So this is the age of first use. According to the National Institute of Drug Abuse, age of first use, and if you do a pride survey in Glen Cove schools, you know this. 12, 13, 14. One or a multitude of those gateway drugs. And yes, because I grew up in Belmore, Great South Bay, it's usually either on the golf course, on the beach, or in the park where young people congregate and experiment with their first mind and mood-altering substance. Nicotine, alcohol, marijuana. From here, this progression, this is the person, God forbid, who's in a Dunkin' Donuts on Northern Boulevard right now, injecting their evening dose of heroin or opiate. They have gone from experimental drug use from 12 and 13 to the most powerful narcotics on the face of the planet within a span of 3 to 4 years. Some. Am I telling you that everyone that uses marijuana will end up there? No. There are some people who will use marijuana. There are some people who will misuse marijuana. Some people will abuse marijuana. And some people may move on to other substances. I'm going to show you a film right now. It was written not by a 49-year-old healthcare professional. It was written by a 17-year-old Locust Valley girl. By the way, she wrote it 2 summers ago. We had it produced last year, and we're proud to say LICADD, right? And it's a year later. How do I know that? Because we got into the Cannes Film Festival with this as a not-for-profit submission. This is based on an experience that she had. It's down here? Okay. The sound is a little rough, but I'm going to give it the microphone. A little preface. This is a difficult film to watch, but the 17-year-old director who's now in NYU Film School wanted it to be as real and honest as it could be. So this is not to trigger anyone, but it's called Hey Charlie. Go ahead.
Can we name her Chloe?
You want to name her Chloe?
Yeah.
Yeah? Hello.
Chloe.
I gotcha!
Faster!
Don't let go, Charlie.
I said faster, Mommy.
Don't let go, baby. Hold on. Hold on. Charlie, breakfast.
Coming.
Morning, sweetie.
Good morning. Charlie, stop feeding Chloe pancakes. See you later.
Don't forget your running shoes.
Yo, nice race, Charlie.
Congratulations, Charlie.
Here, take my hand. Tip it, I tip it.
Charlie, stop! Stop it!
Enjoyment. These, Charlie?
Come on, Charlie. This isn't like you.
Charlie, what are you doing? Get in here!
It's third grade. You remember that? Yeah. Yeah, okay.
Charlie,
Yeah, just 1 sec.
are you okay?
What the hell is this, Charlie?
I don't even know you anymore.
What are you doing with my baby? Get out!
wake up. You're gonna be late. Charlie? Charlie? No, 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 no! My son just overdosed there. I don't know. He's not breathing. He's not breathing. Help! Please help me! Don't let go, Charlie. Don't let go. Hold on.
I couldn't do the work that we do at LICADD without being a gross optimist. I'm a firm believer that, by the way, all filmed on Long Island. That's Brookville. All of it filmed on Long Island. I believe that Nassau County's finest, Glen Cove's finest, Brookville police got to Charlie on time, administered naloxone or Narcan. Charlie went to treatment, and Charlie's doing just fine right now. Despite 600 fatalities on Long Island last year, there were 1,500 Narcan reversals. Find me a disease that kills 2,000, potentially 2,000 Long Islanders a year. That's what epidemic means. To say this is a heroin epidemic is incorrect. Charlie started with marijuana and alcohol, and that progression started very quickly. Now, if you want insight, and we told Congressman Swazi respectfully, you want insight into the human condition, it's not the drug du jour. Oh, you can hear me with that mic? Cool. It's not the drug du jour. For those of us who remember the 1980s, it was cocaine. If you lived through the 1990s, it was amphetamine or ecstasy, MDMA, Molly. Now we're in the middle of another crisis. And get ready, folks, because all of the principals across Long Island, Nassau and Suffolk, have been calling us around vaping and marijuana products. Now, I'm not going to put the young people on the spot, but are you seeing a lot of vaping in schools? Nicotine, THC products? Yes. Maybe you see it among adults, right? Marijuana is a very potent psychoactive chemical. Its potency is a lot higher than what Mother Nature ever intended it to be. There was ways, and this is not a government policy criticism, there are ways of decriminalizing marijuana without legalizing it. Right? You want insight into the human condition, it's not what drugs people use. It's why they use them. Who doesn't have one of these? Raise your hand if you don't have one of these. These were once attached to a wall. I don't know if you noticed. I need to let you know something. In the old days, at 12:30 the national anthem played and then TV went off. There's 482 channels. How does television go off? That was the way of the 5 channels we had saying, go to bed, we'll get back with you at 5:30 in the morning. We're being inundated with images and information, right? Natural and unnatural disasters, realities, right? At a rate we've never before clocked. Some of us are old enough, respectfully, because there are very qualified educational professionals here, right? Some of us, I'm the son of 2 teachers, so some of us are old enough to remember a tragic day in 1999 when 2 misguided youth walk into their high school and summarily start executing their peers in their faculty. Columbine was a tragic, tragic day. Now it's almost a weekly, if not a daily event. If you haven't clocked it, the suicide rate for adolescents and for young adults is at the highest it's ever been. Self-medication. What happens to your phone when it's getting too much information and doesn't have time to catch up? Huh? It buffers or it shuts down or crashes. When we're being inundated with too much information at a rate we've never before clocked, it either freezes or crashes or buffers. We're seeing the crash, folks. Attention deficit disorder, self-esteem issues, homicidal ideation, suicidal ideation, self-medication, adolescent or pediatric anxiety. Let's play a little survey here. I'm going to play 2. Don't worry, I'm not going to ask you if you smoke weed. You ready? Be honest, though. Mayor, you'll play. How many people in this room, adults and youngsters alike, would say they've been under a significant amount of stress the last 90 days? Show of hands. For those of you who don't have your hand up, I'd like to talk to you after, and I have health insurance. By the way, for those in the front row, that's 95% of the room. And whether I'm talking to men and women in lab coats with stethoscopes or men and women in suits, it's always 95% of the room. So why do people use mind and mood altering drugs? I mean, these drugs work. Let's see the next one. So you're seeing signs everywhere for CBD, right? You're seeing, listen, let me preface this. I started my career, I went to college in downtown Manhattan in the late 80s, early 90s. I've already self-disclosed I'm 49 if you're doing that. Back then there was another public health crisis, it's HIV and AIDS. I had friends, and later, as I became a case manager in HIV, I had friends who had lost their battle to HIV and AIDS before there were medications. Let me say this definitively, because the research is definitive. No one denies the medicinal properties of cannabinoids and marijuana. There are 11 approved diagnoses in New York State. We've had a medical marijuana model for the better part of 4 years, and it's been successful. By the way, anxiety and sleep disorder is not one of those 11. Because if you smoke a marijuana before bed, even though that's everyone's choice, I guess, right? That is not sleep, that's kind of passing out. Same with alcohol. Same with a lot of sleep aids. Really important to understand that this is a multi-billion-dollar industry, and it's targeting young adults. I'm not saying if I'm for or against marijuana. Everyone's got a choice. Another personal survey. You ready? Everyone play. Given an all-expense-paid trip, how many people would take the space shuttle to the moon? You'd go. Why would you go? Because it would be interesting.
And this is under the assumption that by safety is secure.
Well, listen, how can safety be secure? We hope NASA is as good as they say, but yes, you'd go. By the way, you're all in the front row, which says something about yourselves, and there are only 3 of you. Why would you go?
I really have a great desire to go and see what's out there.
See what's out there. Interesting. Who was the other? There was a third person. Yes, sir. Why? How do you say no? He said no. Why did you say no? I said no. I know I said no. You're nervous. I don't want to get lost in space. I'm old enough to remember the challenge you blew up. Yes. So a room of 40, 30 people, 3 people. That's drugs. Some people are willing to take the risk for the experience. I'm not sure there's anything I say tonight, or our team, because we work with Glen Cove, is going to make a difference. But we need to educate young people around the potential dangers. Genetic predispositions. There is, let me be clear, because I'm only here to give you the facts as I have them. I just came up from the Treating Young Adults Conference in Harvard. That was a month ago. If you start using marijuana at a very early age, there are serious implications to learning, to memory retention, and you begin habituating. Just real quick, why do people get high? You want insight into the human condition? We need to ask that. Why do you think people get high? Skateboard. Stresses of life. What are some of the stresses of life? What are some of the stresses of life? School. Stresses of life, huh? Life. Give me a life definition. Huh? Family problems. Money problems. Social work. Sorry. What are some other things? Why do you think that? Fit in. I got the weed, you got the papers, you got the lighter, it's on. We can't deny that there are social implications to drug use, right? Listen, you walk up and down the street here, you know it's a bar because what? It says Pablo Bar. That's different than Starbucks. A bar is where people go who have a common interest in the common consumption of their drug of choice. Alcohol. Strangers walk in there, they put the money on this wood table, and they pull this, and they do, right? If we move to legalization, as some other states have, there'll be cafes where people can congregate who have a common interest in the common consumption of their drug of choice. Marijuana or THC products. What's a crack house? It's where people go who have a common interest in the common consumption of their drug of choice. Cocaine. Let's not judge it. There is a social element to substance use, but it's not a healthy one. It's not a healthy one. Now, a show of hands, and this is not a judgment. Let's not judge substance users. I can tell you at least 8 people I knew from junior high school and high school who were academics. They were A and B students, because not everyone is an A and B student. They were athletes, and then they got into smoking marijuana, and suddenly they weren't so much into school and into athletics anymore. They kind of got into getting really cool bongs and glassware. And somehow, no judgment, some of their dreams and aspirations didn't materialize. Anyone know anyone that they remember like that growing up? Possibly? Because marijuana, for some, has the ability to hijack your ability to develop, pursue, and achieve your goals. They define chronic users as people who smoke 3 to 5 times a week. Some of the adolescents we talk to at LICADD, now granted they're coming here, they're either mandated or mom people, but they smoke 3 to 5 times a day. And you ask them why? It's because I just need to chill out. I believe them. I believe young people and adults are dealing with more stress than any other generation before. iPhone's only 2007. We're 12 years into this. I'm sure the elected officials could speak to this, some of the teachers and healthcare. I remember the days when there was work time, and then there was free time. I get emails in the morning. In fact, our 24-hour cards are back there. You can reach one of us 24 hours a day. True story. We'd have an on-call phone. They look like this. They're on the back table. But please take us up on it, because substance use problems happen 24 hours a day. Let's see the next slide. Thank you, gentlemen. THC content has gone up exponentially. By the way, this is from the DEA. This is your federal government. This is a highly potent psychoactive chemical. I don't care what people do. I'm a big believer in free choice. I don't get into legal or illegal. Alcohol killed more Americans than all the drugs combined practically, and that's the legal one. Get ready, folks. Memorial Day and Labor Day. We go from Gulfport's like Belmore, and Belmore's like Huntington, and Huntington's like Glen Cove. We're a summer island. Law enforcement can tell you accidents and drug and alcohol being a drug, increased by tenfold in the summer. We're a destination, and a great destination, I might add. Thank you for your sign. You put some thought into that. Whether you know it or not, that sign's probably going to save a few lives. Okay? This is not the 70s or 80s marijuana. And I think it's really up to, and I have to hand it to Nassau and Suffolk County. We weighed in immediately and said, you know what? If you're going to sell drugs, including alcohol, and we do, maybe now's not the time. Because we haven't yet emerged from the opiate epidemic, where we're still number 1 and number 4 of the highest incidence of overdose in the entire state. People don't wake up and say, today's the day I use OxyContin, or today's the day I use heroin. It starts with THC, vaping, nicotine, or marijuana products. How about the next one? Any questions? Gets into a little bit of the science here, folks, but again, it's not what people use, it's why they use it. You know, there's a book